7 News time is 6:50, and this morning in our morning checkup brought to you by Tele Medical Center, Dr. Fahd Rawra is here to talk about schizophrenia, what it is, and who it affects and what treatments are. So good morning to you.
Yes, good morning.
I guess let's define it here first. What is schizophrenia?
So it's a very severely disabling mental illness. It affects about 1% of the population. I know it doesn't sound like, but that's a pretty high number. It affects men and women equally. The only difference is men usually get the illness a little earlier. They'll get it in their teens to 20s. Women will get it in their 20s and 30s. One of the things that you get with schizophrenia, as far as symptoms is concerned, people will get what we call hallucinations. So either they're auditory or visual hallucinations. Usually it's auditory hallucinations. That is, people will hear things other people won't hear. And this is very real to them. Voices can be one or more. They'll sometimes talk to each other, sometimes command people to do things.
Is this like split personality, or is that a different thing?
That's actually very, very different.
Okay,
yes.
This is more paranoia?
Paranoia, yes.
Okay.
So that's the second symptom that I was going to talk about, delusions. So you're very convinced that something's real, basically a fixed belief. That's what a delusion is. People might feel like the radio waves are trying to control their mind, FBI is after them, and they're totally convinced of that. Treatment-wise, we start with medications. That can be a little bit of an obstacle because these people don't feel like there's anything wrong with them. So it takes a little doing, explain to them. They just feel like, well, that's, well, the FBI is after me, so it's after me.
This has to be hard to diagnose.
Yeah.
Yes or no?
Or hard to get them in
to
admit.
It actually, I apologize, but first it's not. It is something that we do watch over time. The symptoms are just so severe that it's easier to pick up than you'd think.
And is it mainly family members that may come to you and say, what do I do?
Well, there is. I'm glad that you brought that up. There is a genetic component to it. So people with schizophrenia, their family members are at increased risk for the illness. That's the only association that we know of. There is some mention of some viral illnesses, but that's more circumstantial. They end up having certain symptoms, withdrawing. So when they're having these symptoms, they can either withdraw because they are so scared, or it can come out in agitation as well because, hey, this guy's after me, my neighbor's trying to control my mind. Either I'll hide or I'll confront this person. So a lot of bizarre behaviors. Maybe the police gets called in and they show up. And
is it treated by medication?
It is treated by medication. Once symptoms are better controlled, then psychosocial interventions, which is basically sitting down with counseling, with therapy, trying to explain to them, hey, this is what's going on with you, and also helping them kind of function in the community, because their level of functioning is kind of lower because of the illness.
Yeah.
All right, good information. We appreciate your time this morning.
Thank you.
Okay, thank you very much. We're back here in a couple of moments. Your forecast coming up.